Hi, what's your bone health like? Well, should you be concerned? It turns out that 40% of all women and 30% of all men will have an osteoporotic fracture during their life. So yes, it is reasonable to be concerned because that is incredibly common. And is it significant? You bet it is. 20% of all women over 60 years of age will have a hip fracture, and this is really bad news. Half of those women will die within 2 years. Of the half remaining, half of those will end up in institutionalized care for the rest of their lives. When it comes to men, 2/3 of men who are 70 years of age or older will die within a year due to the complications of a hip fracture. So yes, this is something you should be concerned about. Well, why is bone strength such an issue? Well, we know that from the age of approximately 30 years of age, we have our maximal bone density, and over time, that just drops off. And at the same time, we lose muscle mass as well. So we lose the ability to respond quickly, to balance, but we also have frailer bones. So the risk of fracture increases. And this is significant. Well, what can you do about that? How can you check your bone mineral density? Well, we don't feel if our bones are weak. We feel if we're muscularly deplete, but we don't feel it in our bones. Unfortunately, fracture is often the first sign of osteoporosis. But there is a way you can get a feel for what's going on. And by knowing simple things like your age, your weight, whether you've used estrogen or not, and whether you've had a previous fracture or not, we can put that information into the Osteoporosis Risk Assessment Instrument, which is a published piece of work allowing us to have the best idea as to whether you should be screened for bone mineral density problems, in particular, a bone mineral density scan. Well, I suggest you hit the button, and there is a good chance we might pick something up, and if we don't, then that's really good news. So hit the button, follow the survey, and we'll go from there. Take care.